Hello, my name is Tiffany, and today I will be giving information on how to respond to a victim in a sudden illness situation and give care in a first aid situation as well. In the sudden illness situation, first we have here, this is obviously a victim of a stroke. He has weakness on one side of his face, weakness and numbness in the arm, and slurred speech as well. Now, what would you want to do in this situation is make your victim as comfortable as possible, because you can't do anything else in these stroke situations. Call 911 immediately or healthcare personnel. You want to keep the victim talking, ask them their name, tell them to say the alphabet or whatever you can do to try to converse with them and to keep them calm throughout until help arrives. Now, what you would do, and if this happened to a child or an infant, you would act in the same way. You want to keep them still, calm, and try to have help arrive as soon as possible. Signs and symptoms leading up to this event. There were no signs because a stroke is a sudden illness. Allergies and medications, there were none, or no previous past health history of strokes. Last oral intake is we don't know because we could not communicate with the victim, and events leading up to, there were none, just doing regular activity. Now, for our first aid scenario, here we have.
Here, I'm just slicing a piece of cake. I cut my fingertip, I think.
Here we have our victim here who has not too deep laceration on the finger. Now, how we would care for this is we would want to put on gloves and clean the wound with warm soap and water. And we would do the same for a child as well. We would give them the same proper care. And the signs and symptoms, there were none. The allergies and medication, has no allergies and aren't on any medication. And past health history, last oral intake, we asked our victim, which was pizza, and events leading up to was he was cutting cake and cut his finger with a knife. This is how you give proper care steps to a victim who was in a situation of a stroke, and also someone who had a laceration on the finger. This concludes my presentation. Thank you.